Now, you're a student of human performance, of athletic performance. Spermidine obviously has an improvement on energy, on cellular function, on just, I would say, performance overall. But now let's get into what a lot of our audience listen and are about, which is more on the medical side, which is healing almost. Maybe some symptoms or even chronic disease that they're living with. What have you seen? I know you work with practitioners, you work with medical office. What have you seen as far as aiding? We're not going to say treating, of course, here, preventing. Sure. These aren't the words we use for supplement, but in helping patients at least alleviate some of the symptomology, what have you seen?
Well, we've seen 3 or 4 big things, and I'll walk you through them. The first thing that you notice phenotypically when you begin to use Spermidine, about 3 to 5 weeks in, most of our customers tell us they notice a change in their fingernails. Their fingernails start growing like crazy. And we get a lot of reports of improvement of hair. And so when you go back, and if someone wants to learn about Spermidine, the thing, I refer them to an article that was in Cell, that it's called Spermidine in Health and Disease. It's a great review article, and there's 5 benefits that paper talks about. And one of those is the upregulation of epithelial stem cells. Now, your epithelial cells are the cells that make your skin. Okay, they make so not just the skin on the outside, but they also make that lining of the gut. Those are epithelial cells as well. And so when you have the upregulation of those stem cells, again, phenotypically, you really see it show up in fingernails start growing like crazy. That's the big thing that we notice. Okay. Everything else on benefits has to be measured with some other marker. Now, we just did a small pilot study here in this country, and we had a group of patients use our 6 milligram product for 30 days. So we just released a 6 milligram product that's available through physicians, and they use this for 30 days. So we measured blood markers that included blood sugars, blood lipids, inflammatory markers, and we did quality of life measures as well. We measured at 0, 15, 30, and then 45 days. So we supplemented to 30, but measured at 45 days. When you look at the blood sugar markers and the blood lipid markers, not only did they improve throughout, but it continued to improve at the 45-day mark. And this was important to us because I think listen, this is working deep in the cell. A lot of supplements you take hit a receptor, fire something on the nervous system, and there's an immediate response. That's not the way this product works. This product has got to have time to work down into the cell to upregulate that autophagy and then go ahead and start that process. But at 30 and 45 days, we saw a dramatic improvement in all the sugar markers. So insulin, sugar, and A1C all improved. And the lipid markers, triglycerides, HDL, LDL, all improved. Our inflammatory markers were mixed. We had some improvement, so we don't think it was a pilot study. It was really small. We didn't have a big enough N in this to get any kind of power, but we wanted to look for some initial, what are we seeing with it? So where do we start to look? Now, we backed that up with a paper that came out, it's now almost been 3 months ago, looking at fatty liver disease and spermidine supplementation. So one of the things we see when you supplement spermidine, we saw an improvement in fatty liver in humans. So, and it talks about the paper, and frankly, I'm not a good enough chemist to dig down into this. I need to work on that a little bit more. But they saw an improvement in the enzymatic behavior in the liver, and it was the lack of spermidine that caused the drop of this enzymatic behavior that caused the increase of fatty liver. As you restore spermidine, you restore the enzymatic behavior, and you see the resolution of the fatty liver, which falls right in line with our blood sugar studies. I mean, these things go hand in hand. So this was really exciting. So it's not just that classic autophagy pathway and inflammation, but we're starting to see this at an organ level. You talked earlier about, medicine and what we do. Medicine classically trains our doctors at an organ system level. Okay, there's a problem with the heart. There's a problem with the kidney. There's a problem with the liver. Well, what we're finding is that medicine needs to operate at a cellular level. And so when we start looking at, I use a talk, I do a term in my talk is you won't die when you run out of time. You die when you run out of energy, and energy is a mitochondrial issue. And so when we look at mitochondrial behavior, mitophagy, all these things, these are all upregulated and improved with autophagy that is stimulated through spermidine supplementation.